Hi everyone, Dr. Hall here. We're doing the internal structures of the heart now. So I've started with my right side of the heart, which I've coated in blue because it's going to carry deoxygenated blood, and my left side of the heart, which will be pink. The atria will be up here and the ventricles will be down here. The first thing we're going to start with is the right atrium, because that is the part of the heart that the blood is going to encounter first. So deoxygenated blood coming from the body enters the right atrium through the superior vena cava. So I'm going to make an opening for my superior vena cava, and the inferior vena cava, right, are going to drain into the right atrium, as well as the coronary sinus, so that vein that was carrying the deoxygenated blood from the cardiac muscle itself, part of the coronary circulation, and its opening is going to be over here. So I have my openings of my superior vena cava, inferior vena cava, and coronary sinus. There is a little valve across the opening of the coronary sinus to prevent blood from flowing backwards out of the right atrium into the coronary sinus. The other feature we're going to see on the inside of the right atrium and also on the inside of the left atrium is something called the fossa ovalis. Fossa means like a depression or a window, and it's oval in shape. So let me tilt it so you can see. There's going to be this very thin area. Let's see if I can make it. Whoops, I tore it. So this very thin spot in between the two atria. And that exists because during fetal life, when we were in the womb, we actually had an opening here called a foramen, which means hole, ovale, oval hole. So there used to be a total opening here so that blood coming from the placenta into the right side of the heart could go right over into the left atrium, left ventricle, out through the aorta. So our fossa ovalis, the oval window or oval depression, is going to be on that interatrial septum, on that wall in between the two atria. Another really interesting structure in the right atrium, which has all the cool accessories, is this ridge right here, and that's called the crista terminalis. Terminalis as in terminal, as in the end of something, and that is where we find the end of a certain type of muscle, which are these parallel strips of muscle on the inner wall of the right atrium that are called the pectinate muscles. Pectin means comb in Latin, so somebody thought that looked like the teeth of a comb, and this is from the anterior wall of the right atrium. So the only other feature that I would be missing if I was trying to do 3 dimensions would be the auricle, right? So the auricle would be kind of that most anterior structure. I open up the right atrium, I see the pectinate muscles, which end at the crista terminalis. I see my opening to my superior vena cava, opening to my inferior vena cava, and the opening in the valve of the coronary sinus, and the fossa ovalis or oval window right here in between the two atria. So blood now from the right atrium, this deoxygenated blood from the body and the heart, is going to travel through our first valve, the tricuspid valve. Tricuspid because it has 3 cusps, which are these big leaflets. That one's a little too big. Let's try these. Right, these big leaflets. And then there would be a third one here, but because I want you to be able to see, and I can't really do that. So imagine a third one here. And so this is the tricuspid valve. And those leaflets are going to allow blood to come in this way. They're going to open that way. But they're not going to allow blood to go back this way because of some structures in the ventricle. So let's look at the ventricle here. The inside, the interior of the ventricles on both sides have a very strange kind of cross-hatched appearance to them because of the orientation of groups of muscle fibers. And this pattern is called the trabeculae carnae. Trabeculae is in trabeculations, like girders and struts, because that's kind of what it looks like. So if you remember from trabecular bone, same type of thing. Carnae means meat, muscle. So we have these trabeculae carnae. We also have 3 muscles called papillary muscles. Papillary means finger-like. So these finger-like projections of, excuse me, of muscles that protrude into the ventricle, and these hold onto the heartstrings. Now these would be attached to the leaflet here, so I'm just going to skip those. Right? And so the papillary muscles hold on to these heartstrings called the chordae tendineae, tendinous cords, chordae tendineae, which then extend from the top of the papillary muscles up to the cusps of the valve. I'm only doing 2 here for form's sake, but there are many. There's many of these. And what these do is they prevent the leaflets, the cusps, from being able to blow backwards, right? They're going to hold it like parachute strings. The valve can open like this, but if it tries to go backwards, these chordae tendineae are going to hold it taut. The final feature inside the right ventricle is going to be the septomarginal band, sometimes called the moderator band right here. So that's your septomarginal or moderator band. And it's kind of basically a big trabecula. And it's clinically important because part of the nodal conduction system travels through here. Part of the right bundle branch actually travels through here. So in the right ventricle, we have our trabecular carne, we have our papillary muscles, our chordae tendineae attaching to the cusps of our tricuspid valve, and the septomarginal or moderator band. So now we're going to move on to the left side of the heart. And so the left atrium, of course, is receiving freshly oxygenated blood from the lungs through the 4 pulmonary veins. Remember, vein means it's carrying blood back to the heart. So they are bringing blood to the heart from the lungs. I don't think I made those holes big enough. So we have 4 of them, 2 from each lung. So we have our 4 openings of the pulmonary veins into the left atrium. That freshly oxygenated blood then will enter the left atrium, move down through our other valve here, which is the bicuspid or mitral valve, because it just has 2 cusps. So just 2. This one will also have papillary muscles with chordae tendineae, doing the same thing as before, preventing these valve cusps or leaflets from being able to blow backwards into the atria, preventing the backward flow of blood from the ventricle into the atrium. How well am I doing here? Not so awesome. Okay. It's tricky, right? Okay. So there we have some heartstrings are broken. It's a broken heart. All right. Oh, so there we go. We don't have a septomarginal or a moderator band in the left ventricle. We just have these 2 papillary muscles, and we do also have the trabecular carne. I can't get that to stick, but you know what I mean. Okay, there we go. So you might have noticed that I haven't yet done the blood vessels that the blood is going to leave the ventricles from, and that's because things are going to get a little wonky once I start to add those. So before we do that, because it's going to cover up some things, I want to point out this area here. So this is the septum or wall in between the 2 ventricles. So it's called the interventricular septum. There are 2 regions of it. Most inferiorly, it's very muscular, and so it's the muscular interventricular septum. But up here, it gets very thin, and there's no real muscle to speak of. I'm going to move these valves out of the way. And it's the membranous interventricular septum. So what I'm going to do now is I'm going to add our big blood vessels that are taking blood out of the ventricles. So the left ventricle, of course, is going to pump blood into the aorta, which you know is posterior to the pulmonary trunk. So I'm going to put that one in first. So the aorta here is going to extend superiorly, right? And that's coming out of the left ventricle. As it contracts, blood is going to move up there. And then the pulmonary trunk, put you back, is going to take blood out of the right ventricle and up to and out to the two lungs. So remember, the pulmonary trunk is the more anterior on the heart. They will switch. And I want to show you the valve here. So the pulmonary valve and the aortic valves are both what are called semilunar valves, and they're called semilunar valves because they have these three little cusps that look like little half moons. So this third one would be here. So let me see if I can give you an end view. So it kind of looks like that on the end view. So there's my pulmonary valve, my pulmonary trunk. My aorta, which also has an aortic valve, I'm going to do a separate section for that because there are some additional structures. Let's review everything else. Here's my aorta. Let me remove that. Oh, okay. So starting again with the right atrium, we have the pectinate muscles, cristae terminalis, opening of the superior vena cava, inferior vena cava, opening of the coronary sinus with its valve, and the fossa ovalis, the really thin spot between the two atrium. Tricuspid valve, papillary muscles with the chordae tendineae, moderator or septomarginal band. Muscular interventricular septum, membranous interventricular septum up where the aorta and the pulmonary trunk are. Left side, we have the pulmonary veins, and there are 4 openings into the left atrium, bicuspid or mitral valve, again with papillary muscles and chordae tendineae. And that's it. So that's the internal structures of the heart, and I'll do a separate piece on the aortic valve because it's special. Thanks.